You online, Kyle?
Yep, I'm here. You guys hear me?
I don't know if you can hear me. I can't hear you, but I see your lips moving.
Yes, Kyle, this is Nancy. I can hear you.
Okay.
Hi, it's Michaela. I can hear you.
Okay.
This is Missy. I can hear you.
I wonder what Mike's got going. Mike, can you hear me now?
Kyle, this is Nancy. If he didn't click on the join with audio, I've had students who miss that little text box, and that prevents them from using their audio. If he's never used this before, that might be his issue.
Okay. Sounds good. I'll get him squared away.
Kyle, this is Dave DeBodge. I can hear you.
All right. Sounds great.
Hi, Kyle. This is Dr. Welling and Dr. Pettigrew, and we can hear you too.
Awesome. Thank you.
I can see you're talking, but I can't hear you. This is Hamrick.
Mike, can you hear me now?
This is Dan Kirkpatrick in Ohio.
Hey, how'd you get a hold of this thing?
Matt Owens contact.
Okay. Right on. Right on. You're that guy. Sounds good.
Uh-oh.
No, he just said he had somebody calling in. So, all right, we're going to get going probably about 7-8 minutes, just getting some things fine tuning. I think we've got a number of participants on the line already, so just hang tight a little bit. If somebody has Mike Hemrick's phone number, just give him a call. Actually, I'm just going to give him a call, and we'll get him squared away.
I turned my volume up. I can hear you now, Kyle.
You got me?
I got you. Yep.
Perfect. Good job. Good deal. All righty.
It's really scratchy, but maybe it isn't with other people. If it is, I'm gonna sign off and get back on, so.
Yeah, maybe try that, or even just mute completely the call. And then there's a phone number on there you can call into as well. So that might make it a little more clear. So you can still watch it, but you'll be on the phone.
Kyle, Brian Ingerson here. Can you hear me?
Yes, sir. Can you hear me?
Yep, I can hear you great. Nice hat.
Yeah, I knew it. I knew you'd like that one.
I just want to let you know we can hear you good up here.
All right, sounds good. We'll probably get going in about 5 minutes or so. Let everybody get logged in, and then we'll get started. So for those of you that are on early here, if you have not logged in to the South Dakota EMS portal and signed in for this class, go ahead and do that. If you have no idea what I'm talking about, send me an email or a text with your name as it appears on your EMT card, and I will sign you in. We're going to have everything open until about 10 o'clock tonight for those of you that are trying to get credit hours for this. If you can't get it accomplished, let me know, and I will get you signed in. I'll be back with you in about 5 minutes or so.
Kyle, I'm gonna leave the meeting and come back in and see if my speaker works better. Because I
Sounds
can't
good.
understand anything right now.
Sounds good, Mike.
All right. Call Jackie Rao, mobile.
Calling Jackie RAU, mobile.
You were on, because I heard you just say call Jackie Rao, mobile, on the computer. But my audio, but I can't hear anything. Yeah.
Hello? How you doing? Good, I think you're on, right? Are you in front of your computer? You got camera? Okay. Oh, you got to turn your camera on.
All right, guys, let's mute. If you're not muted, please. Mike, you're not muted. There you are. All right, we're going to give it just a few minutes here. Wendy, Matt, Dr. Owens, can you hear me at all? Dr. Owens, do I have you on the line at all? If you're not muted, could you just please mute right now? Dr. Owens, do I have you on the line? All right, everybody, just hang tight. We're going to get Dr. Owens on the line. I got him. He's calling me right now, so just hang tight. Dr. Owens, do I have you on the call? Dr. Owens, do I have you on the computer? Got IT people working on it.
Try this first. Yeah, can you hear me?
I've got you, Matt.
Very well.
I've got you,
All
Dr.
right.
Owens. All right.
Hey.
All right. So let's everybody mute for 1 second. And I'm just going to kick it off. I got just a couple things really quick, some administrative stuff, and then I'm going to turn it over to the experts. So welcome, everyone, to this call tonight. I have to give a big shout out to AHEC for organizing this. Michaela and Sandra contacted me about a week ago, I think today, something like that. And we started talking about they asked what they can do to help us get some information out to the group. And this all came together within a week. So Michaela and Sandra have really helped us. Michaela put all this together. And so, thank her. This is a tremendous partnership that we're forging here. And for those of you that don't know, AHEC was a main player in our refresher this year. holding that up at PC with the PC group, Dr. Welling and her staff up there. So we're really appreciative of this, and we can't thank them enough for helping out and making this happen. Just a couple of quick things before we get rolling is there are hours available for this course. And like I said a little bit ago, if you have not signed in through the portal, the EMS portal online, go ahead and do that. The phone lines are going to be open on there until about 10 p.m. If you don't know what I'm talking about or you've never done that, just send me an email or a text with your name and how it appears on your EMT card, and I'll get you signed in before 10 p.m. so you can get credit for these hours. There will be 2 hours credit. Again, if you are not muted, please mute your mics. I think maybe we have the entire group muted, but make sure your mics are muted. I don't want to have to get upset like Christy did today in the governor's address. If any of you watched that, there were some unmuted mics going on this afternoon on that. So what we're going to try to do so we keep this orderly is we definitely want to hear from you guys. We want questions. We want all of that stuff to happen. This is here for you guys to ask questions. We've got some very good experts on the phone tonight, and we want to make sure that everybody has the opportunity to ask questions. But how we're going to do this and to make it orderly is between myself and Michaela from AHEC, we'll be monitoring the chat portion of this thing. And please put in there that you have a question, or if you just have a question that you want to ask over the chat, you don't want to go live on the group, just go ahead and ask it in the chat and we'll ask it for you. If you want to speak, we're going to wait until all the speakers are through tonight to take any questions, just so we can keep things flowing. So hit the raise your hand button. If you guys saw that, hit that and we'll be sure to get to you. I can't promise we're going to get to every question tonight. This is far and away more people than I expected to be on the line. We have over 60 participants on the line. So that's fantastic. That's what I wanted to do, is pack this Zoom meeting. So that's great. Actually, it's up to 70, almost 70. So that's awesome. So thanks for your cooperation in that. And I do hear some mics that aren't muted. So if you could mute your mic, that would be fantastic. Just a couple things that I'm going to throw out there quick, and I know Matt or Dr. Owens and his presentation is going to cover a lot of this. I just want to make sure that everybody's contacting their receiving hospitals and having at least weekly dialogue with those hospitals, because this thing is changing so rapidly. So make sure you're staying in contact with your hospitals. And again, if you can mute your mics, that would be great. Thank you. We still have to train, even with our new world of social distancing. So we still need to do continuing education. So please figure out a way that you can still get hours out to your group. There's a number of online options. The Zoom meeting works pretty well. I've been in a number of these in the last couple of days, in the last couple of weeks, and they really work good. There's Skype, there's GoToMeeting, there's all sorts of different options. So we still need to train our people. We still need to have continuing education, and some of the services still need to have meetings. So use these options as possibilities for those things going forward. Because if any of you did listen to Governor Ohm's address this afternoon, we're looking at a couple of months yet. And I'm going to kind of leave it to Matt and his group to kind of talk a little bit more about that. He's probably got a lot more information on that. But we're into June, into July, potentially into August here. So we have to be innovative. We have to find ways to get training and to hold our monthly meetings. And then just keep your crew up to date on the changing procedures. These things are changing so rapidly, so just make sure your crew knows what's going on. I'm going to put a little pitch in there for mutual aid agreements. Make sure that you've talked with neighboring ambulance services. We're doing this as a communication type of a exercise. So if there's anything that the district can do for any of the ambulance services, please let us know. There's going to come a point in time, we don't want to think about it, but we're probably going to get some of our providers sick. They're going to get exposed. They could potentially be quarantined. So we still want to make sure that your ambulance service is able to operate. I know some of you have very small services with 2 and 3 EMTs. If you get 1 or 2 of those people potentially exposed and have to stop going on calls, who's going to go on the calls? So reach out to the district, reach out to your neighboring communities, and ask for help if you need them. We can be a liaison for that. If you need help, don't hesitate to ask. We're in unprecedented times. You guys have heard that many times. So the biggest thing is that we want to communicate with each other. We're all on the same team here. We're all after the same goal. We're all trying to do the same things, but it's going to get difficult at times. So We need to be thinking about the mental health of our patients as well as our responders, and we need to address those as they come up. There's a couple of websites that I put on this slide for you to stay informed. Make sure you're getting your news from a viable source. There's rumors running rampant about things, and we just want to make sure that you're getting your news from a viable source. So use the cdc.gov website, use the covid.sd.gov website, use the Department of Health, doh.sd.gov, providers, rural health, EMS. There's a lot of good information on there. So use those websites. So with that, I am going to turn it over to Dr. Owens, and he's going to visit with you. Again, make sure your mics are muted, and we're going to hold questions till the end. If you have questions throughout the presentation, go ahead and put them in the chat portion of this, and we will be sure to get those asked once the presentation is over. Thank you.
Okay, this is Dr. Owens. Can you hear me?
We can, sir.
Okay, oh, there we go. Anyway, my name is Dr. Owens. I've been started off as a U.S. Army medic and then an EMT. Been involved in disaster planning, etc., for about 30 years. I'm a member of the International Society of Disaster Medicine and Public Preparedness. The other thing I'd like to add, I'd like to throw out a shout out, a big thank you to Colonel Kirkpatrick, who's also on the line from Wright Pat Air Force Base. He's a retired colonel of the United States Air Force. Basically ran the hospital, the first Allied hospital in Desert Storm. He's my go-to guy on logistics, etc. I want to thank him for being on, and we'll get on with the show. So first, let's go down and talk about coronavirus. So basically, we've all been exposed to coronaviruses. They're very common in a lot of different species. We usually call them the common cold. This one's different, causes severe acute respiratory syndrome. The previous one was called SARS-CoV. The one we currently called COVID-19 because of the year. It's in the same family as the MERS virus and the SARS virus from a few years ago. So it's a large family of viruses. This one actually came from a bat. And I'm going to now show you a few slides of how this thing got into the United States. And these will be a little bit dated because this is a very fluid situation. So basically going back to late January, about 500 cases in China, and we had our first case. And if you note, just about 19 days later, we went to 37,000 and 12 in the United States. Moving on just a few weeks later, it's looking like it's growing around the globe. We only had 62 confirmed cases in the United States, and that was a month ago. Moving on to the 16th, as you can see, this virus really can move. And especially when you think this virus has no legs and no wings, one of the key take-homes from today's talk is don't be an Uber for this virus. So just moving along here, we were already at 1,629 cases. That was 2 weeks ago. And here's some March 1st data. As you can see, it's pretty minimal. Current data would suggest I've lost my sheet, but I'm sure it's, go ahead, next slide. March 9th that it spread. And then moving on to the next one. That's update about 2 weeks ago. I believe we had more deaths than cases reported at that time. So the routes of transmission. Yeah, did you see where I wrote out some numbers? Basically, this is an upper respiratory issue. They've detected it in feces, and then we're going to talk about fomites. To bring you up to speed, what I just checked before this meeting, the United States alone, we have 270,000 people infected, and we have over 7,000 deaths. Worldwide, 1 million affected, 54,000 deaths. So once again, the route of transmission is very important that you understand it. It's basically droplet and direct, like getting droplets in your face from a cough, that sort of thing. That's why the 6-foot rule is very important to understand. Next slide, please. So the spread is primarily with these respiratory droplets. This is not like TB, where it stays in the air, stays in your ducts, or stays in your ventilation systems. Most common, once again, way to get it is to get coughed on or to pick up droplets off a handrail or a countertop or opening a door. Less commonly, people can get it with contact with sputum, serum, and blood. The incubation period is what's very concerning to most of us, and should also be concerning you folks, because it's anywhere from 2 to 14 days after exposure. And then the real question becomes, is the latency, and this is extremely worrisome. So especially with our younger population, how long from the time they're exposed to the time that they're contagious with the virus? Because a lot of the younger folks may never show a symptom. And if you don't know what the latency is, it's very hard to control a disease. For example, I'll discuss a thing we're all well aware of. So influenza, basically the reason how we control it is through immunizations and meds. But the other thing is it's latency. So from the time a person is contagious to the time of their first symptom is generally 24 hours or less. There is some data out there saying a lot of folks are never even going to show a symptom, but yet will be spreading the disease. The other thing is fomite. So I'm hacking and I'm coughing on the checkout lane at the grocery store. It's been documented up to 4 and possibly even longer where this little chunk of RNA, this virus, is actually sitting there waiting to make you sick. So that's why when you see from the CDC, not only recommendations concerning airway protection, but hand protection, and why you see a lot of people just, and we all should be, very aggressively washing our hands, because as humans, our hands usually end up on our face. So this is some old numbers we talked about. March 16th, those about a 3.7% mortality rate. And then as it kind of moved into Italy, it looked like maybe the death rate was going to go down. And here's another question that we really can't get a real black and white design on. The air in China is extremely bad. They have a lot more pulmonary issues than we do in the States. I believe it's about 50% of their men smoke. So their mortality rate looks like it's higher. But once again, that has to do with premorbid conditions such as COPD, diabetes, hypertension, heart disease, and also contact or contagion risk. So I've seen everything from 2% to 4% for mortality rate, with the exception of nursing home patients. And there it looks like it's going to push in that low 20s, with another 20% of those nursing home patients never getting back to their previous level of function. So most common symptoms reported, you probably all heard this, basically dry cough, short of breath. The middle numbers are very much very fluid as far as how many people will actually be critically ill. We do know that if you're over 55 to 60 and you have heart disease, COPD, diabetes, your death rate goes up dramatically.
Ready?
So close contact. Now this is very important. So you see the pictures of the Las Vegas Strip and Chicago and New York and LA before all this hit, and people are all very close together. They're going down the street 1 to 2 feet apart. Well, that is an extremely high-risk environment to be in because you're within range of the cough. One cough may expose 6 or 7 people. So one of the things that CDC came out with early is stay 6 feet away from all other individuals. That's the best way to prevent the illnesses, like in everything else in healthcare, is prevent the exposure. So if you're sick, you need to call the clinic. You may be directed to one of the COVID hotlines. Stay at home until instructed. This is critical that you don't just go walking into an ER. For those crews, while you're on the rigs, you need to be calling ahead saying you have a 60-year-old male, high temp, dry cough. So if that ED is already COVID ready before you even offload of the rig. But as individuals, if you have any of these symptoms, also stay away from others. And if you have to go out in the public, definitely wear a face mask. I just actually rather that said, don't go out in the public. So this is a little bit up in the air of this slide right now. So it says face masks should be utilized for those with symptoms of COVID-19. Actually, there's some data that says just wearing a non-medical mask may decrease the risk of transmission, primarily because it blocks your hand from your face. Not so much that it blocks transmission from somebody that's coughing these fomites on you. The next one is probably not correct. What the CDC is trying to do is find that happy medium where people that are out in public or in wherever situation you're at, if you have to come in contact with people, have some sort of face mask, but they also don't want to have a run on the market, as we've seen on the East and West Coast, where their face masks, either surgical or N95s, are not available to the healthcare providers. Basically, hand hygiene is critical. It's worthwhile to go look at the CDC website about how to properly wash your hands and actually how to properly use your sanitizer. And you may want to develop a buddy system, especially when we get to the N95, but just be looking out for each other and say, hey, we just got off the rig. Wasn't anybody that looked like they had COVID-19, but make sure everybody's getting their hands washed, their stuff cleaned up. Currently, there's no antiviral treatment. Hydroxychloroquine and azithromycin have some data to support that they may improve outcome. Right now, it's all about high flow oxygen and ventilators. And basically, oxygen therapy is best reserved for those with severe respiratory distress. So best practice, don't touch your face, don't come in contact with sick individuals, which you folks will not have the option of. If you yourself are sick, stay at home. And we talked about the hand and contact measures. Basically the next steps, and this is a couple weeks old, you can tell by looking at the top slide. At that time, they wanted to recommend the organizers for the next 8 weeks, cancel or postpone. I think that's more out to probably mid-summer at the earliest, excuse me. The other thing is they initially came out with, the idea was if you're in groups of smaller than 50 people, that would have some relative amount of safety. That new number is 10. I would say 1 is probably a safe number. Trying to add a little humor here. Okay, next, yep. All right, so here's where the rubber meets the road. Let's first talk about modeling with our colleagues in the infectious disease world. They look at models, and there's a lot of variables, and that's why it's pretty difficult for me to flesh out what's really going to happen in South Dakota, because I don't think you can necessarily take data from, you know, Wuhan, China, population 9 million, where everybody's living really close, and extrapolate it to South Dakota. But I'll have a number of models here that will show why we're trying to do interventions. Basically, this one should scare everybody. If we do no interventions, at the peak, we'll be at 9.4 million Americans, and we'll have about 1 million total deaths. And for those that aren't history buffs, that's on the same magnitude of American troops that died in World War II. That scares me. So if we put off our intervention, if interventions had started in March nationwide, at the peak, we would drop from that multi-million-dollar count down to about 533 infections. Once again, this is for the United States. So if we waited till June to close down bars and large gatherings, etc., you can see where We dropped that from 9 million, which is doing nothing, down to 4.5 million with about 500,000 deaths. If interventions start in July, once again, numbers start looking more like World War II. Basically, these graphs or these modelings are basically models are just that. They're taking the best data available, applying it to the best viral data that we have with our testing data to try to determine outcomes. And it also, these graphics, primary utilization is to try to give people a sense that these changes, I preached this quite a bit in the last couple months. This is a behavioral disease, people. It does not have legs, does not have wings. You have to have another human involved in order to get this. So don't be that human. Now, you've probably heard about this quite a bit, and this is where things also can be a bit hairy. So there's an idea of what's called health system capacity. If you're above it, it's called above surge. If you're below it, you're below surge. If you're below surge, we should have a fairly adequate, not the best, but we should have a fairly adequate response to this with hopefully enough ventilators, enough ICU beds, enough equipment and gear and people to manage it. But if we do not get this curve down, and I mean like today, things have got to change. We're going to go way over the curve, and basically there won't be enough ventilators, there won't be enough oxygen, enough ICU beds, and basically as a physician, that means I'm going to be practicing 1918 medicine and offering people morphine for the pain, Ativan for the anxiety, and that's all I'll be able to do for them. So it's paramount that you as individuals within your communities get out, talk to your elected officials, your county, your city, and just pound this thing that every bar in South Dakota should have been closed 3 weeks ago. Every bowling alley, we should be on stay-at-home rule right now. By not doing that, I think we're going to see us go quite a bit above surge, which will lead to a significant amount of deaths. So when you look at that risk profile, over 55 and comorbidities, and you look around at the average age of South Dakota EMTs, I would say at least 3/4 of South Dakota EMTs fit the high-risk capability definition. So with that being said, we've done some things with Sanford School of Medicine over the last 15 years in training up students from across a variety of both OT, PT, speech therapy, MD, PA, dental hygienists, etc., to be able to respond to this sort of thing. What's holding us up from activating them is the governor has to declare a state of emergency, and we have to invoke the SERV-SD, which has already been legislated, that was done 5 or 6 years ago, in order to get these student force extenders out there. And one of the things I'm looking at for Redfield, and be more than willing to talk each and every one of you, is if we can get that SERV-SD in place, we could offer you the second and third year medical students who at that point in time would have roughly 7 years of healthcare training to basically pre-mobilize to your communities and act as force extenders for these rural EMS volunteer nonprofit agencies. And I need to have feedback on that. Kyle, I don't know what the best way to get feedback on that. What we plan to do in Redfield is we actually have a house that's for students, and upon activation, I'll put at least 2, if not 3, medical students over there, and then we'll assign them each a EMT that they'll be working with. And by the way, a number of these medical students were EMTs prior to going to medical school. And that way we can cut the risk, cut the number of calls that volunteers have to go on, and hopefully improve outcomes. So basically, to round this up, this is a behavioral disease. We're stuck with it. We have to practice social distancing right now. We need to get SERV-SD up and running, and we need to get ready to hunker down because this is going to be ugly. So I guess I'm not the Stay Puft Marshmallow Man today, but I think folks need to hear this for what it is.
Dr. Owens, would you be ready for some questions, or did you have some other things you wanted to go through?
No, just go ahead. Let's.
With questions?
Yeah. Yep.
Okay, so if you have a question, go ahead and unmute your mic and then ask your question and then mute it again as soon as you're done asking your questions. We did get a comment out of Groton, South Dakota, said thank you for your honesty. I think that's kind of a big thing right now, that there's some groups out there that are maybe trying to sugarcoat it, and it's great to hear it from somebody who has been training for this pretty much your entire career. So we really appreciate it. Any other questions or comments out there?
Can I add an accessory to that? If you're looking for the real deal, his name is Dr. Tony Fauci. You see him on some of the, with the president, and he also does not believe in sugarcoating, and that would be that in some of the university-led, like Washington State University, even has curves designed for each state. You need to look at that data and nothing that you're getting off the internet, because what I've seen on the internet is it's manure.
Kyle, this is Dan Kirkpatrick in Ohio.
Yes, sir. Go ahead.
Yeah, I just want to say everything Dr. Owens said is absolutely correct. And whether it's sugar-coated or not, we need to follow exactly what he said. We're doing that in Ohio now, and I still think we're behind the curve, but we've been doing some of the things that Matt talked about for several weeks now. One of the things they're looking at is they're going to allow senior nursing students to go ahead and function as licensed nurses now, and they will take their state boards 90 days after the crisis is considered over. And the idea is put those nurses to work in facilities where not so much taking care of COVID-19 patients, but taking the burden off of the experienced nurses so they can go in and take care of the COVID-19, and the new nurses right out of school can take care of the non-COVID-19, the less serious patients. So there's a lot of things here in Ohio we're looking at, but everything Matt said is dead on.
Thank you, Colonel Dan.
Thank you. We do have one question from the chat portion. Do you think there will be a vaccine anytime soon?
Anytime soon is a tough question, because I don't see that there would be any vaccine to affect the curve, to affect this pandemic. Now, hopefully we'll have something on board by next fall. There is some data out there that says this may become similar to influenza, where it becomes a seasonal infection. There's also a lot of data out there that says that's not the case. More to come, don't know.
Thank you. I interrupted you there, Dr. Owens. Did you have a comment to make?
I have a question.
Sir, go ahead, Dave.
Okay, guys. So majority of us are volunteers, and I'm wondering if there's been any discussion amongst the experts about maybe isolating our EMTs from the workplace to keep us healthy.
I guess I can chime in there, and I'm sure Dr. Owens has something too. I have not heard anything as far as anything coming down from the state on that. And Dr. Owens, go ahead. You might have something else on that.
Right. I don't have anything specific to the shelter, the EMTs in place. What I can say, I've looked at healthcare shortage and workforce development for a number of years in South Dakota. And in a pandemic like this, the first bridge to go down because of the structure of the state's population, I don't think the hospitals will go down. They may go down, but what I'm saying is the rural EMTs will be down way before the big hospitals go down, which in effect makes them ineffectual, because if I don't have somebody to transfer, and by the way, folks, we're still going to have people having car wrecks and heart attacks, and Yeah.
I do have a question from the chat portion. At one point, something was said about people having type O blood were immune. Is there any truth to this?
Well, I'm going to speak to this from the science standpoint. It's kind of like the medications that have been kind of floated out there. Their studies are not big enough to make any scientific statement other than it's a suggestion. Right now, of course, azithromycin and hydrochloroquine are being used in some facilities for the most extreme cases. But once again, very limited data if that actually is the right thing to do. Once again, we have to prevent this, people. If your town still has places open or grocery stores that do not have hand wipes, that are not requiring people to use hand sanitizer, you have to be the shock troops now to get the public health message out, because I guarantee you, you're going to be the ones picking them up for those that aren't following the game plan. Once again, I can't believe there's any business, bar or anything like that should be open in the state of South Dakota.
Here's a question from the airwaves again. Do you think we should automatically put a mask on all patients?
The current CDC is suggesting even people out walking are going to be wearing masks. I've got a couple of our experienced EMTs here in the room, and our general, once again, we're not running short yet. I would not put an N95 or a high-grade mask on, but just a simple surgical mask on them. Remember, a surgical mask does not protect the wearer very much. It protects everybody else. Think about it. Surgeon, she or he has got this mask on and opening you up. That's preventing their bugs in their mouth, their upper airway, getting into you. It does provide some safety benefit, but nothing like an N95 or face shield and gloves. Does that make sense?
Yes, I think so. I just wanted to put a little bit of a plug in there before we take the next question. Is if you are running short on things, the way it's kind of set up right now, and I think the way I think we got a couple people that are not muted. Could you just mute for 1 second? Thank you. So the way that they're kind of running things through the state cache, if you don't have enough equipment or whatever the case is, I think the best route of getting the things that you might need, or at least getting some of that stuff right now, is talk to your emergency manager for your county. The emergency managers can probably go through a little bit easier avenue to possibly get some things, and try to make just one point of contact in your county as well. That has been something that's been preached on the South Dakota Healthcare Coalition side of things, is sometimes we're doubling up on asks from the state. And the last thing that we want to do is ask for something and then get two of them and then short someone else. So if you are needing something, if you're running critically low, if you don't have the proper PPE, go ahead and visit with your emergency manager, as they're going to have an opportunity to probably take care of some of that stuff, or at least start those conversations maybe a little bit easier than each one of our own ambulance services can. I know we have a couple of EMs on the line, and they're probably saying, man, my phone's going to be flooded. Thank you very much, Kyle. But I think that they would rather have you go through them than potentially double up on asks. So that's one thing. And then my next point I'm going to make before we go back to the airwaves is go ahead and try this stuff on. Understand how these suits, if you're running with suits, if you're running with gowns, know how to put them on before you get the call. That is a big one. So that's going to be the best thing to do. I'm getting a couple of chimes in here. I got one that said, yes, contact your EM. Another one was, emergency managers have been directed to have entities by themselves order PPE. However you do it, just make sure that you're running it through a single point of contact. It would be a great thing that we follow the chain of command in this, chain of just the route that we're asking. If you do contact your emergency manager and they tell you to order it yourself, great. If your EM is going to take care of it, great. There's really probably no right way to do it. We just want to make sure we don't double up. All right, we're going to go back to the airwaves. I did get a comment. The Department of Health has been very clear that all PPE orders go through them, not emergency management. So there you go. However you're doing it, talk it through with the people in your county. So you're only ordering it once. That's making a very long story even longer. But you don't want to double up on orders. So however you're doing it, talk it out with the leadership in your county and only order it once. Go ahead, sir.
Yeah, hey, the other thing is, now is the time to get to know your friendly local community emergency manager, because game day is not the day that you do the hi, how are you? Do you follow what I'm saying? So somebody from each one of the agencies, and maybe you've already done this, should be reaching out to your county EM and just saying, okay, this is where we're at. I know our local EM here has a daily kind of a address that goes out over social media. I believe he's getting about 2,900 hits a day, and that's a good way to get the information out. And while I've got the bully pulpit here, the next question is, and we need to kind of run this through, probably through you, Kyle. How many folks on this chat have been fitted for an N95 mask?
I think maybe the best way to do this, since we have 75 people on, is maybe put it in your chat portion, and maybe just one person from each agency. If we can have the service directors, if they're on, put it out there. But if say we have 10 people from one agency, don't probably have everybody put it in. So the question is posed: how many people have been fit tested for an N95 respirator? So go ahead and put that in the chat, and we'll kind of get an idea as we're going through these to see where everybody's at, and we can kind of move that one back a little bit. I do have one other question, Dr. Owens, that popped in here. Do you recommend emergency responders start with a hydrochloroquine Z-Pack as preventative measures?
No, absolutely not.
Thank you.
We'll run out of that so fast that, there's not enough data. There's some data for the really sickest of sick, but there's not much data for as far as prophylaxis. Back to the N95 mask. This needs to get done like Monday. This N95 thing if we get nothing out of this other than Owen says, get on your leadership to get your communities closed down. Number two is every one of you need to get in line and get this N95 fit testing done. And we need to put pressure where pressure is needed to be placed to get it done.
So Matt, a question on that is, how would be the best way to get that done quickly? Who should we contact? Who should we talk to? And so how can we do that? Do you have any words of wisdom there? Because I'm seeing a lot of no's. I'm seeing a lot of no's
too, and it's bringing my blood pressure up. But that's got to get done. Let me think about how we could get that done, both from a regional, district, and statewide, because it does require, you got to do the sniff test. You got to prove the thing works. For those of you that are prior service, it's somewhat similar to the CS riot gas test we took with our gas masks, but it doesn't smell as bad as CS riot gas. So.
Guys, can I jump in here?
Sure, Dave.
Maybe Cassie Haskell can mention this also and talk about it. It took us several weeks. We ordered our kit, and it took several weeks for us to get it in before we could do a fit test.
Can I reach out back to Dan Kirkpatrick? Do you agree that should be #1 priority?
Absolutely. The other thing, you mentioned how important it was learning how to put on PPE. Even more importantly is learning how to properly take it off. We did studies in the Air Force back several years ago, and what we found is that people got really good at putting it on, but they self-contaminated consistently taking the gear off. So you got to practice taking it off without contaminating yourself.
Thank you.
Do we have any other questions from the folks that are on the call?
Dr. Owens, Mike Hamrick from
Yeah.
Ipswich. Thank you for everything. Hey, when we go on every call, we're practicing eyewear, N95 masks and gloves. And when we get to the patient, we're putting on a surgical mask before we start asking the pertinent questions that we need to ask to rule out.
Outstanding.
And we're also, if the patients can come outside and they're ambulatory, we bring them outside before we question them and put the mask on.
Sounds like your best practice.
Before we even put them on the
community.
cot, okay?
Yep, that's a best practice community then.
Okay. My other question was that in order to use an ambu bag, you need a HEPA filter, correct? That's the CDC recommendations.
That is correct, and that comes from SARS data where other than the patients, the anesthesiologist had some of the highest death rates because once again, it also is a coronavirus. And anytime you aerosolize, whether you're giving a neb or whether you're intubating, you need to be at that HEPA level, basically PAPR level is preferred. Now, I do know that that won't be happening everywhere, but that would be our goal.
We did a scenario, Dr. Owens, where if we came across it, and we've had 4 meetings already, where if we do have to bag, we didn't have HEPA filters right away. I did come up with a couple, but we put a surgical mask on a mannequin and we bagged through that, but we put, to get a good fit, we put a CPAP mask on and we bagged them through the CPAP mask. And we also cut a 1 mil 5x5 piece of plastic and threw it over the patient to try and keep all the droplets going down instead of at us.
So I think you folks are the direction that we need to be going, but yeah.
I just wanted, we have HEPA filters now, but we're still, with the HEPA, we're still going to put a surgical mask on when we bag, unless we put an gel in, and we're still going to use the plastic over top, try and keep the droplets down. Is that okay?
For now, like I said, the preferred thing, if you're going to be bagging anything where you're going to be pushing those droplets out, and Dan, jump in here wherever you want. Preferred would be a full-blown PAPR, but I also live in the real world, knowing that probably may or may not be the case.
And we're going to have
I agree with you, Matt.
on when we do that.
Okay, say again.
We will
Matt, this
have
is Dan. I agree with you.
Okay.
Yeah, I'm gonna jump in there on one quick thing. There was a question that came in over the airwaves. What's the best way to disinfect the first responder after a call? Is it just soap and water and the normal hygiene, or is there any other way that the first responder can be disinfected?
Yeah, basically you want to doff the equipment you wore, and I can't stress that enough, so you don't recontaminate. And then throw your stuff in the laundry and go take a shower.
Perfect, thank you.
Yep.
I'm gonna go also back to, okay, we got it taken care of. There will be a recording of this posted. So for those people that did not get to go through it, the only thing with, if you're watching a recording, we technically can't give you the hours. So I know the information is probably way more important than the hours to most of you. So unless I can get something changed there on Monday, which maybe I can. So any other questions that are going to be coming out there? I guess I did have somebody come in with the shortage of test kits for fitting the N95. Is there anyone, I'd assume anyone that can do that? I think we're going to try to get back to you on that. I'm going to use the email list that I sent this out to originally today. It was about 5 different email lists, but I'm going to combine them all, and that's how we will continue to communicate through our district. And I also have someone else on the line who I'm going to turn it over to for a little bit. Keith Sharisky has been leading the effort with the Aberdeen Fire Department, and a number of you rely on Aberdeen Fire as your ALS agency. I know some of you don't, but there's a number of the group up here that does. I also want to make a pitch back out to Ipswich before I turn it over to Keith. Is Mike, it sounds like you guys are really got a good handle on this. Can I ask you a favor? Can I ask you guys to write up your policy and send it to me so we can start exchanging some of that data? Because I don't think we need to reinvent the wheel if somebody has a really solid policy or a procedure out there. So if you guys could write that up and just send it to me, I think that would be fantastic. So if you could do that, that'd be great. I'm going to turn it over to Keith Sharisky right now to maybe just give you a quick brief on what Aberdeen Fire is doing and what they're asking of the rural agencies if you haven't been in contact with them. Keith, are you able to jump on?
Can you hear me?
Yes, sir.
Oh, good. Apparently I didn't push the right buttons at the beginning. So Kyle, give me a quick rundown. What all did you guys talk about?
Dr. Owens went through what the COVID-19 is, talked about modeling, talked about that stuff, talked about how to protect ourselves. So I'm just kind of wondering, maybe from Aberdeen Fire's standpoint and what you've been working on over the last month or longer, what are some things that you're maybe wanting agencies to have taken care of before they intercept with you?
Okay, so let's talk about a lot of stuff. First off, when you're intercepting with Aberdeen Fire and Rescue, we are going to be using Aberdeen Interagency. BC3, our county dispatch center, will be attempting to contact your dispatch center to verify some questions. And the questions are the simple screening questions, but that gives us a lead and a heads up on making sure we have the appropriate PPE. Our guys will always be in PPE, but if we can get the screening questions, it may allow them to take the PPE off. So short story, we'll be on Aberdeen Interagency. Dispatch, or our dispatch, will attempt to contact your dispatch to get these questions. And more than likely, we are going to be taking your patient out of your ambulance and putting them into our ambulance. Questions on that? Okay, speaking on the EOC side, Brown County EOC is up and running, limited. And what I mean by limited is 2 weeks ago, we went full bore for 3 days. And then we are now meeting once a week just to see where everybody's at on stuff. The plans are dynamic, as well, as you guys all have heard. Today we targeted field hospital setups. I'm sure you guys all heard Governor Noem talk about the National Guard setting up field hospitals in Rapid and Sioux Falls. Hopefully Dr. Owens, when he talked about the modeling, specifically talked about the modeling towards us. But I'm going to tell you right now, we are really upset with the Department of Health because they are not talking with the EOCs and letting them know what their local communities modeling could be expected. Every community, local communities model is different, and the Department of Health has access to that, but they're not sharing it with the other local communities. So we're not warm and fuzzy with that. Other things that we got going on, we are dealing with, are helping with food, looking at PPE shortages. Everybody's having a certain amount of PPE shortages. For you guys that are outside Brown County, make sure that you're getting with your local EM finding out where they're sitting at as far as EOC setup and making sure that they have a line to the state EOC and making sure they have, you have the appropriate and amount of PPE that you need.
How you doing in here, Hack?
As far as patient cares are
Keith.
concerned,
Keith, I hate to interrupt, Keith, but we've got some people that have mics that are not muted. Could you please mute your mics? Go ahead, Keith. I think we got it.
okay, sounds like a plan. I left off at making sure that you contact your county's emergency manager and making sure that he or she has a line to the state EM and making sure that you've requested, inventoried, or realized the amount of PPE that you're going to need. The smaller hospitals are at a significant disadvantage right now. They are lacking PPE. We're finding this out throughout the state. And I guess I would ask your smaller hospitals, you guys that work with your smaller hospitals, to get in there and talk to them and make sure that they've got their stuff lined out, including their PAPRs. Let's see where else I was going with this. I guess I hit my highlights. I would entertain any specific questions. I will attempt to answer.
Do we have any specific questions for Keith while he's on? Do I have Dan Milkey from Aberdeen Ambulance on? Is Dan on? Do I have anyone from Aberdeen Ambulance on?
So I've got just one more thing, Kyle.
Go ahead, Keith. Sorry.
No worries. For, let's see, Marshall, Day, Spink, Edmonds, and McPherson counties, and Ellendale Ambulance, I've been sending out daily updates. I review the CDC's requirement for PPE or recommendations for PPE on a daily basis. I look at the numbers for the surrounding states, including Minnesota, Iowa, Nebraska, Wyoming, Montana, and North Dakota, only our border states. I also monitor the WHO website and the state and our border states Department of Health websites. That's where I'm getting my information, and if you have specific questions, that's where I take my information from. I do not use any of the news outlets or anything like that, because that is unverified, unverifiable information.
Perfect. I appreciate you reiterating that. Just another comment that came through in the chat for those of you that are watching that is emergency management can track PPE, but just make sure that any requests are going to be sent to the Department of Health. Just consult with your emergency manager. They're going to have the best avenue for you to do this stuff. So that's just kind of where I'm going with that. I'm not trying to step on any EM's toes. I'm not trying to give them a bunch of phone calls, but I just want to make sure that everybody in the county is talking with everyone else, so we don't have double ups on orders. So that's where I'm going with it. Just talk it through. That's all I'm asking. So if you have any other questions on that, consult your local emergency manager, I guess. But they're going to probably have a little bit more data or a little bit more information, maybe as how to go about it if some of you have no idea how to do it. They can help you. They probably won't do it for you. So that's that. Do we have any other questions from the group?
Kyle, this is Dan Kirkpatrick in Ohio again.
Yes, sir. Go ahead.
Keith mentioned that the Guard is setting up some field hospitals. Has anyone in South Dakota talked with Ellsworth Air Force Base, other Guard unit, other reserve units? They may have some resources that you may not be aware of. The reason I'm bringing that up is I was in a teleconference earlier today with our county public health department, and they have started working with Wright-Patterson Air Force Base to look at sharing resources and helping each other out. So just a question.
I guess I don't know for sure if who they've talked to. I know the National Guard is being called up to take care of some field hospitals in Sioux Falls and Rapid City first, and then they're going to be moving to some of the other areas. Randy, did you have something?
Yeah, just in answer to that, they have been in contact with Ellsworth, and that is part of the plan as far as moving forward as a backup to facilities should they need it.
Perfect. Thank you very much, Randy. Appreciate that. We did have another question that came through. Is some individuals are declaring that COVID is airborne. Is this true? Any one of our panelists can take that one.
So COVID-19 is not airborne at this time. There are studies going on that is showing that at 6 feet, it's relatively safe, but there's one paper out there, and it hasn't been substantiated yet, that says the smaller particles, droplets of the COVID-19 can travel up to 21 feet. Now, I caution you guys, that has not been verified yet. So far as CDC and the WHO is still recommending 6 feet, but also understand, because the science is not new, but the disease is new, and so it's being studied by every single angle you can imagine.
Dan, are you back from? Are you on from Aberdeen Ambulance?
Yes, sir.
Dan, I hate to put you on the spot, but could you speak a little bit to? I believe you guys are one of the transfer groups that's been recognized. Is that true?
Yes, sir, it is.
Could you speak a little bit to how and what or why, or just kind of talk about that? Those, I think it's 8 services that have been identified through the state, correct?
That is correct. We were just contacted by the state when all this first kind of started to come to fruition, where everybody was kind of, Marty actually contacted me and asked if it'd be something we'd be willing to do. Went to the employees and kind of, let them decide if it was something that they'd be willing to do. And most of them said yes, some of them did say no, which is totally understandable. And then basically just signed a contract with the state. They're sending us some equipment. We got some of the positive pressure masks that we just got in yesterday. So got some UV lights to help sterilize, just basically caution practice. And it really doesn't sound like it's, because we actually, I don't want to say have it easy. We're a transport company mainly. So we'll pretty much know the people have it when we're going into it, so we can take the appropriate steps to make sure that everybody stays safe. And so, instead of like 911, you walk in and then you just find out, oh my gosh,
Yeah.
have 2 out of the 3 symptoms. So basically it was just the state asking if we'd be interested, kind of took it to the vote of the employees, and enough people said yes, and we said, yeah, we would,
Okay.
help out any way we could.
Well, we really appreciate you guys stepping up and doing that. One of the questions that I maybe had for you is that's going to be more for interfacility transfers, correct?
That is correct. And from what I'm understanding, unless it's something to where the system is overloaded, they're just going to stay put the way it is anyways, just because, why, if they're sitting in a room and they're by themselves and they're quarantined, why, get an EMS crew involved, take them to another facility, get those people involved. Like I said, from my understanding, it's just going to be mainly like the smaller hospitals coming to like Aberdeen, more than Aberdeen going to Sioux Falls.
Okay, sounds great. I appreciate you giving us some info on that. Thank you.
You're welcome.
We do have some questions that are rolling on the chat side of things. Keith is answering some of those. So if you have some of them, go ahead and answer them. I am going to throw one out there. I'd like to get Dan and Dr. Owen's opinion on this one as well. Keith answered it great, but I just want to bring some light to this because there's some rumor on this one as well. Is there any truth about it being susceptible to heat, and will it slow down as the weather warms up? If Dan or Dr. Owens or both want to kind of jump in on that, I'd appreciate it. Thank you.
Go ahead, Dr. Owens.
Are you there, Matt? What I've heard, this is Dan Kirkpatrick out in Ohio, is we don't know yet. This was, previous, viruses have been impacted by heat, but from what I have heard, we just don't know yet about this one.
Very good. Thank you. I think that was pretty much the exact way Keith answered it. For those of you that don't have the chat, Keith did say some coronaviruses are susceptible to heat. COVID-19 is related to SARS. SARS is not heat susceptible. Science is still researching this. So great teamwork on that answer. Appreciate that. Do we have any other questions? Am I missing any? I know Keith's been answering some. I've just been kind of hitting the heavy hitters. Is there any other questions from the group?
I'd like to talk a little bit more about the heat susceptibility.
Go ahead, Keith.
The science is still evolving on that. Right now, there's only one continent that does not have COVID-19 on it, and that's Antarctica. They're looking at, or the research now, or the models are really targeting Africa and Central America and seeing what's going on there. The heat that people are talking about as far as killing this, I am going to throw an opinion out. My opinion is that it will not be destroyed by heat because the COVID infections are starting to balloon in the Africa and Central America regions.
Kyle, this is Dr. Owens.
Yes, sir.
Can you hear me?
Yep, go ahead.
Yeah, I'm in full agreement. I've been looking at that data coming out of the Philippines, Central and East Africa, and I don't think they have any snow on the ground in the Philippines, so I don't think that hole it's going to go away with heat or get worse with cold. I don't think there's any data to support that. I'm in full agreement with your previous person.
Okay, thank you very much. What about susceptibility to sun and ultraviolet light? Could we have any of our speakers touch on that, or all of you?
Right now, EPA rates the commercial ultraviolet light as a killer of this COVID-19. Obviously, or in my mind, the sun has a fair amount of ultraviolet in there. I would caution people that if the product is still moist, we need to treat it as it's still alive and infectious.
And if I can add in there, some folks are using cloth masks in front of like a surgical mask. And if that gets moist with your breath, you need to get it off and get something else back on. Do you follow? That's one of the problems with the cloth mask. If they get wet, the micropore system becomes less efficient.
I agree. I have not read that anywhere, but in my mind, that makes sense. It's keeping all the moisture right next to your N95s. But again, I have not read that from the CDC or WHO, but it makes sense to me.
Dan, what do you think?
I agree. It does make sense. Scientifically, it makes sense.
Awesome. Thank you, gentlemen. Do we have any other questions? Are we getting to the end of the questions, or does anybody have anything else they'd like to ask?
I'd like to talk about ozonators.
Sure. Go ahead, Keith.
There's a lot of misinformation about ozone generating machines out there. Currently, there's not an ozonator, ozone generating machine that is rated to kill COVID-19. Some of the ozonators or ozone generating machines are advertising that they will kill coronaviruses. This is true, but it hasn't been verified against COVID-19. So be careful if you're reading those websites.
Thank you. And I think that's where everybody just needs to get their info from the viable sources. I think there's a lot of people out there that are trying to make a buck on this, and we really need to educate the people in our communities as well as ourselves. If it sounds too good to be true, chances are it is. So appreciate that, Keith. Thank you very much. Anybody else have anything? Keith, did you have anything else?
Kyle, I have a
Yeah,
question.
go ahead, Dave. Sure.
Keith, could you just touch base on what the ambulance service and the fire department are doing as far as training together on this PPE? I know some fire departments do respond for certain types of calls with EMS, and like us, we would use the fire department for lift assist if we have a patient that 2 EMTs can't handle.
Okay, so first off, Dave, you asked a really great question, and it's a very complicated question. And the reason why it's complicated is because we're dealing with two different groups of individuals. You as EMS providers, when fire shows up, you need to take them under your wing. This, unless they have their SCBA on, they are not protected. So you'll have to take them under your wing. As far as training is concerned, it's going to have to occur like we're doing tonight. The last thing you want to do is bring a group of people together in a closed space to attempt to talk. The social distancing even needs to be applied by all the fire and EMS. So training is, short story is talking like we're doing now and YouTube videos. Cassie did ask a question about commercial UV light is approved by the EPA. Yes, commercial UV lights are approved by the EPA. But be careful, don't buy the hand wand ones. The hand wand ones do not put enough time on disease to kill it. So it has to be a commercial UV light that is timed, typically 15 minutes or greater.
Thanks, Keith.
The question for the N95 testing, does someone have to be certified to do the testing? Yes, you have to be fit tested, and this is to protect you and your agency.
And we're going to work on that. We're going to work on trying to get some avenues for people to be tested. Obviously, with the social distancing that we have to do, we can't just go out to a community and say, everybody show up and get tested. We're going to have to probably handle this a little bit differently. So let me research that, and I will try to get back to you guys Monday or Tuesday on some avenues and some ways that we can get at least our district or anybody else fit tested that needs to be fit tested. Because as Keith has just said, and Dan Kirkpatrick said, and Dr. Owens has said, is this is something that needs to be accomplished extremely fast. So let me go to work on that, and I will get back to you guys as soon as I can on that to see what avenues we potentially have.
If anybody's looking at purchasing a commercial UV light, they are currently 4 weeks back ordered.
Thanks,
or
Keith.
at least our supplier is 4 weeks back ordered.
Yep. Do we have any other questions from the group? Any comments, any concerns? We all have a lot of concerns. I shouldn't ask that one. Dan, go ahead.
Yeah, Kyle, I just want to congratulate you guys for doing this. I'm not aware that our local EMS has done something like this, and I want to say that this is fantastic. My other concern is our governor in Ohio has been very progressive and very assertive about doing stuff like this, and he declared a state of emergency in early March and then did the stay-at-home order March 24th. Has your governor done that yet?
Our governor, as of today, and I watched her press conference right before we started with this, is our governor is not doing the stay-at-home order as of right now. I think that the walls are kind of closing in, that it may come to that. I'm purely speaking just in terms of my own opinion on that. I know she's been very hesitant to do that based on some of the modeling that the state has on it. And the explanation that was put out in the press conference today, and anybody can go on and watch that press conference, I strongly encourage you to, is by issuing the stay-at-home order, her thought process is that it's not going to go away in 2 weeks. So she is preaching more the social distancing, allowing counties and cities to close these businesses through the power and the avenues that they have, instead of issuing this. I do feel that, you look at the map and there's about 7 states that haven't done it yet, and we're all in a clump. So I don't know for sure if it's coming. Don't hang your hat on it. I don't know, Dr. Owens, do you have any insight? I know which way you think it should go, but do you have any insight on if you think it's actually going to happen?
I have no insight.
Okay, so just stay tuned. I don't know for sure which way it's going to go. I think it's all going to probably depend on the next week. And, there's some people that are saying in the next week it might be too late, that we're going to be pushing our peak closer. So I don't know. I don't have enough information to speak to that. But as of right now, there is not a stay-at-home order. And I strongly encourage everybody to go on the covid.sd.gov website and watch her press conference from today. There's some very good information that did come from it, and some of their thoughts.
Well, Kyle, it's Dan again.
Yes, sir.
You guys are the experts. You're the ones at the front lines dealing with this, and make sure your governor understands that. Our governor did. There's a few of us that think he waited a little too long, but at least he did it. And I drove around my neighborhood today just out of curiosity. Nobody was out doing things with neighbors. They were doing things in their own yards. It was 60 degrees today and people were mowing, but people were not going over to neighbors and talking to them. So they're following it as well as they can. And I think that's critically important. And I would encourage you to encourage your elected officials to do that.
Thank you. And for those of you who would like to encourage our elected officials to do that, you could find a lot of the contact info on the state websites for the representatives and senators in your area. And also, I believe there is an email out there that you can email the governor's office. So if that's something that you folks on the call want to do, I strongly encourage you to do that. If that's your feeling. One thing that I would also like to say is I have heard that there are some small communities that are still having, their bars open, restaurants open. Really take information to those owners. I know it's extremely hard in a small town. Those folks work on extremely thin margins. But the last thing that we want to do is have some sort of a super outbreak that you're hearing about that have happened over the, around the country, where 40, 50 people that were at a specific place end up coming down with this. And the majority of you are small ambulance services. I don't think we can handle even close to those amount of patients if they get sick to the point where they need to go to the hospital. So talk to your business owners, talk to your elected officials in your communities. Obviously, like I said, we don't want to see businesses closed down because there's going to be a lot of them that don't come back. But we have to look at the big picture. We have to look at keeping ourselves safe, have to look at keeping our citizens safe and our community safe, because we will all get through this. And it's all going to matter how we act and how we handle the guidelines that have been put in place. Do we have any other questions or any other comments? Talk to the people. Stay away from stay away for another day is what a comment came in. That's great advice. Stay away. Any other comments? Any concern? I hate asking concerns because we all got a lot of them. Any comments or questions for our group of folks that have so kindly jumped on board to help answer questions and give us some really, really good information tonight? Anybody else?
Kyle, this is Sandy Duray again from the AHEC.
Yes, go ahead, Sandy.
I'm just wondering if these kinds of calls every so often would be beneficial. I know as there's new information available, would the folks that are on the call like to have an update? And through this methodology, through Zoom, has it worked well? And I just like a little bit of feedback from the participants.
Yeah, if you guys could go in on the chat, I'm seeing yes, yes, yes. How often would you guys like to do these? Let me get some info there from Dan Kirkpatrick, Keith Sharisky, and Dr. Matt Owens to let's just see what those guys think, how often we should be doing these calls. I know this thing is very fluid. So go ahead, and I'm getting yeses beyond belief. So we will have these again. I'd appreciate your guys' insight on how often we should maybe meet and have these types of calls.
Kyle, this is Dan Kirkpatrick in Ohio. This is actually my 4th teleconference today. And several of the other groups are actually doing them weekly because the situation keeps changing almost daily. I don't know if you have the capacity to do it weekly or if people can get away, but the more often the better while we're still learning about this.
Dr. Owens or Keith, go ahead, Dr. Owens.
Yeah, so back to what I talked about, the modeling. Once again, those models probably maybe so far from reality, who knows, because they're just models. What I think we need to move towards is what we're finding within our little EMS systems. What is best practices? What is working? What is not working? How well is the interaction going with the EM? How well is the interaction going with Department of Health? And I would make time to be part of that conversation, because this is a behavioral disease. We can only control it by action and by messaging. And this group would be the best bunch of messengers, because frankly, you're going to deal with it one way or another.
So, Keith, do you have any input, or do you agree with all that? Are you still on?
Yes, sir, I'm still on. I listened to Dan and I listened to Dr. Owens. I wholeheartedly agree. I believe weekly would be best. That way we can all track and look and watch the science and the changes as they come. And then when we get together weekly, we can discuss these so that we are all on the same page and all taking care of one another. I will have to caution you guys though, I am part of the EOC, and if we do get activated, I will be tied up there for however long it takes.
That sounds good. I think that weekly is going to work. That's what I'm seeing. Just a resounding yes on weekly. Does this time work for everyone? It's that, you know, when we were talking with Michaela, actually, I probably should ask Michaela this. Michaela, are you on? Is this something that we could do weekly?
Yes, yeah, it's really quite simple for us to do it. So yeah.
Awesome. That's great to hear. Sandy, that works for you as well, weekly?
Yes, and I think one of the things that we can do is ask the people that are on the call if there's individuals that they'd like to have that have expertise in different areas. If we could get some other folks to participate too, in addition to Dr. Owens and folks that have been on today, specifically from the state health department or wherever. I think that it's their job to provide accurate information. And so I believe that if we ask them to be on a call, they would welcome that opportunity.
That sounds
if
great.
I can jump in, this is Dr.
Sure.
Owens.
Yes,
Just
sir.
like we've done with that training, I can reach out to folks at the med school, that sort of thing, to get that level of expertise. You folks are experts in rural EMS. We have experts in this field in virology, epidemiology, that sort of thing with the med school. As long as I have how many days heads up, 3 to 5 days, I will try to make every effort to bring the med school online with us and act as basically an information center.
That sounds great. I will tell you guys a little quick story. When we first set this up and I said, well, let's try to do it Friday night, I thought, man, we're not going to get anybody on this. But like one of the comments that came in is, can't go out or do anything else on a Friday night, so why not do this? So I think this time on Fridays is going to work the best, probably, as everybody's winding down from their week or don't necessarily know what day it is anymore, because we have some folks that are working at home. So if we can do it weekly at this time, I think that we're going to try to move forward with that. And Sandra, do you have anything?
No, just Kyle, thank you. I guess the opportunity to work with you and our commitment as an AHEC to supporting EMS services in the state is one of our top priorities. So if there's anything else that we could do through these critical times, we'd appreciate folks making us aware of that too. And Kyle, your leadership has been outstanding. So thank you very much.
Well, I could have done it without you guys. So I definitely could have done it without you guys. And having 70, almost 80 people on the first call, I think is fantastic. That really shows the commitment from all you guys. And I think it's wonderful. So, keep it up, keep the fight up. We know it's not going away tomorrow. It's not going away next week. So,
Kyle,
yep, go ahead, Keith.
I know you're trying to wrap up as best as you can.
We got time. We got time.
I've been answering some questions privately, and several questions have arisen about staffing and taking care of our staff and all this other good stuff. Short story is, everybody in South Dakota is going to get hurt when it comes to staffing. The departments throughout the nation are losing at a minimum of 25% up to 50% of their staff. The CDC has come out with several updates, if you will, on how to keep staff working. I'm going to speak to how Aberdeen Fire does it to protect its staff. Currently, every call that we go on, every member has to have their N95, their eye protection, and their gloves on. It does not matter if it's high risk or low risk call. Once they get that risk assessed, then they can adjust their PPE. The reason why I'm telling you this is, according to the CDC, if we go in with N95s, eye protection, and gloves, even though we went into a high risk patient contact, we will not be removed from service. We just have to be monitored for the next 14 days. Services, I'm going to speak for Aberdeen Fire. I'm under the impression Aberdeen Ambulance, we both monitor on a daily basis. I would ask you guys to consider implementing something like that in your local areas. That will help keep you guys, it'll help keep us all working through this potential concerns that we're going to have coming up. Also, I would ask you guys to start reaching out to your local agencies and start working on a backup staffing plan. It is going to hurt no matter which way we look at it. Aberdeen Fire cannot, I cannot offer Aberdeen Fire up to help back the local agencies up. The rationale for that is that we are dedicated to the citizens of Brown County. It sounds heartless and cruel, but that's what we're dedicated to. We will do everything we can to come help, but Brown County comes first for us.
that makes perfect sense, Keith. And here's some things to also think about is, I know I've heard of a fair amount of folks who maybe are not going to renew this year. For those of you that have those people in your area, they have pushed out the renewal date back to June. So anybody who was not planning to renew this year for some unknown reason, or they're retiring or whatever, talk to those folks, get them back on board. Talk to EMTs who have retired, who are still in, good physical condition and can still possibly go on some runs with us. Let's get them back trained as evac drivers and utilize them to the point where they can be helping us on calls. I know it's going to be a little bit crazy to just start pulling people, and I'm pretty busy right now to start EMT or EMR classes, and there's been some constraints put on us there as well. So to fire up a brand new class and hopefully we're done in 9 weeks probably is not going to happen. So lean on some of those folks who have some medical training in your community, retired nurses, retired EMTs, anybody who's got some training. Let's get them back into the fold. Let's get them, evac trained so they can at least drive for us, so we can put another EMT, in the back if needs be. That's just kind of be my pitch, is find those people in your community who can help. I mean, we don't want to just pull anybody, because there are still some liability issues, and we still have to abide by the rules and regulations that the Department of Health has put out for us. But if you have those folks in your community that can help, let's go ahead and grab onto them, talk to them. They're probably more than happy to jump back on board. That's really about all I have to say on that. There is a question that did pop through. Keith, could you please speak to the available resources for the responders or even the residents regarding mental health? Do you have any ideas there, or Dr. Owens, or anybody else that would have any insight on that? Thank you.
So for mental health, that's really tough. The EOC is attempting to, or we have made contact with mental health providers. Right now, the way we understand it is that they are standing their own plans up on how to take care of things. As the infections increase in our neck of the woods, their business will be increasing as well. They are working through their telehealth, telemedicine. I can't speak any further than that, other than they're trying to stand that up. CISM will be available, but the problem is CISM falls into that greater than 10 people. So this might be, and I haven't talked to Becky Kook about this, but this is probably something Becky and us and Patty and Brian Cones and a couple others should get together and try to come up with an idea. A couple other questions were brought up, if I can keep talking. So how are you going to make yourself safe in farming and ag? Short story is that particular business, you're already at an extremely low risk. You're outside, you're typically by yourself. Your risk is extremely low. Your risk gets heightened when you start going to, I'm going to use going to John Deere and buying a brand new tractor. That's when your risk starts going up. But even agencies like that are separating their salespeople and their floor people out so that it makes it safe. If at any time that you're in with a group of people, again, the CDC recommends 6 feet. My opinion is 6 feet or greater. Try to call. That's the best way. If you're working with a group of people on your staff, separate them out. They don't need to sit side by side. Another question was if you intercept with Aberdeen Fire Rescue. Yes, we will restock your disposable supplies. We will not restock your N95s. If your equipment's compatible with our equipment, we will restock you. Cannot speak to Aberdeen Ambulance, but I understand they also do the same thing. But again, I can't speak to them. I would ask you to contact Dan when it comes to that. That answers all the questions that I see on chat, Kyle.
Yeah.
Kyle,
Thank
this
you.
is Dr. Owens. I'm going to jump in. And
Yep. Go ahead.
You
bet.
You sound like a broken record here, but we're all old enough to know what that means. That's funny. Anyway, the easy button on this, well, there is no easy button. But one thing that would certainly help is if we could get enough pressure on our folks out in Pierre to activate the ServSD. Mr. or Colonel Kirkpatrick has actually been at our training. We've trained 5,000 students in the last 15 years, and about 70% of them have signed up to volunteer for this sort of thing. And if we can match every EMT in South Dakota with a third year or fourth year medical student, I think that's a going ideal. They're going to have a little bit of just-in-time training. But once again, as I said earlier on this call, quite a number of them were EMTs before they went to med school.
That sounds good. I did want to put a pitch in there. Mr. Randy Maddox did put a comment up that if somebody needs help now, you can call 211. They have a list of resources out there. So appreciate that, Randy, very much. Do we have any other questions, any other comments before we wrap it up? I'm going to ask each kind of panel person who's been answering questions to just do a quick wrap up if we don't have anything else. So Keisha Risky, would you like to go first on that, please?
Thanks, Kyle. I really don't have anything more to add other than all you guys, you're more than welcome to call me. I will attempt to answer your questions. Call the fire department. We're here for you. Just give me a call. I'll try to help as best as we can.
Thank you, Keith. Dan Kirkpatrick, would you like to have a few closing remarks?
Yeah, thanks, Kyle. I just want to reiterate what Dr. Owen said at the very beginning. Take this very, very serious. We have not seen the spike yet that we're going to see in this country, and it's going to get worse. And you guys are the heroes for being on the front lines. And I just want to thank you for the opportunity to sit in and listen. I'm very impressed with what you're doing. Thank you.
Thank you, Dan. We appreciate it, and we hope that you can be a part of them in the future. Also want to say a quick thank you to Dan Milkey from Aberdeen Ambulance for giving us that info. We really appreciate that, Dan. Now, Dr. Owens, would you like to speak?
Yeah, one last line. We got to get on this N90 thing like think on you know what. Because otherwise what we're doing is we're sending you folks into combat without a gun and without a helmet. It's got to get done. Like now.
Thank you. And, thanks a lot for those folks who have taken time out of their evening to get on the call. A shout out to Randy Maddox for giving us some really good information, and we'll definitely get you on the email list. Appreciate that, Randy. So in closing, guys, we are going to have these every Friday evening, 6:30 to 8:30. We will get a list of speakers. If you guys have any speakers that you feel are subject matter experts in stuff that we can be doing, we'd appreciate it. If you have a plan that is a best practice plan, and I'm going to pick on Mike and Ipswich again, is if you guys could write that plan up, that sounds like a pretty good plan. Let's put that together, because if you do not have a protocol in place, that needs to be something that you're going to do in a couple of minutes. Because if you don't have a plan in place, that means that there's probably somebody on your service, somebody in your department who does not know what to do when a call like this comes in. And that could potentially have very adverse effects if we don't have a plan in place and we're not training people. We can train through Skype. We can train through GoToMeeting. We can train through Zoom. There's a lot of opportunities. I've showed a lot of old dogs new tricks this week, and I'm one of them when it comes to learning some of this technology stuff. Find those younger EMTs who are good at it. Have them walk you through it. This is probably going to be the new norm for a while. And I just really appreciate that everybody has taken time out of their schedule to add insight, to answer some of the questions, and it's really much appreciated. So with that, I think we're going to sign off unless somebody else has anything. Michaela or Sandy, do you guys have anything to add?
I don't have anything.
Nothing for me either.
Well, thank you guys again for giving us this platform to do this on. It's very much appreciated. So I think with that, we are going to go ahead and sign off. If anybody has any questions, comments, concerns that pop up after this, you can email me, and we can get those on next week's list. But just stay safe. We're all in this together. You guys have heard that 1,000 different times, but rely on the EMTs in your neighboring communities if you need help, and just realize that we all have each other's backs. We're a small community of EMS providers, and we all need to band together and help each other out in this time. We need to keep each other safe and keep our community safe. So with that, I'm going to call it a night. Thank you all very much, and I hope that you have a good week and that we can talk again next week. Thank you.